Mr. Moses Sinclair is a 68-year-old male that came into the office with the chief complaint of right hand pain, not being able to hold or grasp onto things, and dropping things. History of present illness is he's a 68-year-old male complaining of right hand pain and weakness. Began about 3 months ago in the right hand, wrist, and center of the hand. It comes and goes. It's achy, shoots from the wrist into the fingers, and aggravating factors include using the hand too much. Relieving factors include rest ice and Tylenol extra strength 1,000 milligrams. Treatments are Tylenol 1,000 milligrams extra strength every day. Severity is 8 out of 10. He has no known drug allergies. He takes Tylenol over the counter extra strength 500 milligrams times 2 PRN every 4 hours as needed for about 2 weeks for the right hand pain. He has medication tolerances to Advil and ibuprofen. They give him a stomach ache. His past medical history includes right hand pain times 3 months, no chronic illnesses, denies any hospitalizations or surgeries. Social history, he's employed as a tailor for 30 years. Upon reviewing of the systems, he did have some pain in his neck, but that's been going on for about 10 years. It's constant. He says it's about a 2 out of 10, and exercising it every 20 minutes relieves the factors. He describes it as a mild ache, and he takes Tylenol 1,000 milligrams every 4 hours as needed, but no decrease in range of motion. And he does report unilateral weakness in the right hand, reports shooting pain from the wrist to the hand, trouble grasping and holding onto things for 3 months, location in the right wrist, in the center of the hand. It's intermittent. He describes it as aching, shooting pain from the wrist to the fingers. Aggravating factors are too much usage. Relieving are rest ice and Tylenol 1,000 milligrams for every 4 hours PRN. He reports it severity as an 8 out of 10, and it impacts his daily work and lifestyle. He reports it hurts to open and close the hand, denies pins and needles sensation, reports tingling, denies throbbing, and denies decreased sensation. Denies any trauma to the right hand or recent falls. Upon assessment, his vital signs were within normal limits. His musculoskeletal exam was all within normal limits, no decreased sensation or decrease in range of motion other than the right hand weakness. His cranial nerves were all intact. His deep tendon reflexes were all 2+ and regular. He did have a positive Phelan's test, pain in the right hand, positive Tinel's test, pain in the right hand, and a pinched nerves test, pain in the right hand with decreased strength. Differential diagnosis include carpal tunnel syndrome, cervical radiculopathy, and peripheral neuropathy. My assessment is that Mr. Sinclair, whose occupation as a tailor involves repetitive hand movements, faces the highest risk for developing carpal tunnel syndrome. His current symptoms include weakness, tingling, and wrist pain radiating to his fingers, which are consistent with this condition. Notably, symptoms tend to escalate with activity but improve with rest. And the Phelan's test elicited, and the pinch test and the Tinel's test also produce these pains, which is consistent with this diagnosis. My suggestions would be to get a nerve conduction study or an ultrasound to go ahead and definitively rule in or out this symptom, this diagnosis. Medications would be to continue using over-the-counter Tylenol to effectively manage the pain. If this becomes not effective anymore, we can prescribe something such as naproxen. If symptoms continue to worsen, we can also look into corticosteroids injections, keeping in mind their side effects. Non-pharmacological treatments would include wrist splinting, ergonomic adjustments, and physical therapy. And patient education would just include to emphasize rest and icing and taking regular breaks. Referrals include occupational therapy and physical therapy for splint fitting and guidance on hand exercises.